I want to reassure people that, yes, veterinarians have to make money just like computer engineers and just like teachers and just like grocery store workers and literally anybody who has a job. Like everybody expects to get paid for their job. But I think that whole interview was essentially an advertisement that disparaged the veterinary community, and I'm just not okay with it.
I agree 100%. I think it went too far. It was a little inflammatory. It was a lot of finger pointing at the veterinary profession in general about, again, back to we're only in it for the money, and then go from there, cartel, private equity, mafia.
And the killing your pets.
Pets, and the $5,000 dental.
We didn't even get into that. We got to back up.
Welcome to Diagnostic Tails, Animal Imaging's Uncovered podcast.
Each episode offers insights into the world of veterinary imaging, sharing stories, breakthroughs, and advancements in imaging techniques.
Hey everyone, welcome to Animal Imaging's Diagnostic Tails podcast. We're super excited for you to join us. This month's episode, Paws and Perspectives, Debunking the Veterinary Scam Myth, is kind of in response to the recent Tucker Carlson interview that he did with Joe Spector. And we have a lot of feelings on them. And so before we get into those feelings, I'm Dr. Amy Armentrout. I'm a boarded surgeon. I practice primarily in equine sports medicine and surgery. We do a lot of imaging here, and I'm sure for those of you who don't know, Animal Imaging does all species. And while this podcast is a small animal podcast, so I'm just here for local flavor, our star, the real star of the show, is Dr. Lon Hays, and I'll let him do his own introduction.
Well, thank you. I appreciate that. I don't know about star, but I'm here. So yeah, I'm Dr. Lon Hays. I am the small animal veterinarian here at Animal Imaging, taking care of referrals and the imaging modalities for our small animal referrings in the area. Have been practicing going on 31 years, was a partner in a practice here in Dallas for 25 years, which I sold. We had a partnership ownership in a emergency clinic as well. And then I've been a partner here at Animal Imaging, one of the original investors with Dr. Jake Hirschman about 23 years ago now. So have been here in the Dallas area since 1995. So it's kind of my background. And my wife is a veterinarian as well. We graduated together from LSU. So she's a practicing veterinarian here in the Dallas area as well.
Yeah, and both of you have been in general practice basically since you got out, right? Until you at least joined us here.
Correct. Yeah. So my practice was just general practice, exactly. Small animal only. And I've been over here at Animal Imaging going on 4.5-ish years, somewhere in there. Yeah.
So I think kind of when we start this, I know that when it took me a couple tries to get through the Tucker Carlson interview, just because there were some feelings. I had some strong feelings. And I think there are a lot of strong feelings on both the pet owner side, right, and the veterinarian side. And so we're going to kind of discuss all of those, right? I think that what we got presented was a very, one-sided view. Joe Spector says that, he's the CEO of Dutch and that they're, financed by venture capitalists, and he'd started a different company before focusing on telemedicine. And I think we just, they were upfront that he was an advertiser and that he was interviewing an advertiser. And I feel like the majority of that interview was an advertisement at the expense of the veterinary professionals, which I found unfortunate.
Yeah, it didn't shine a very positive light on the veterinary community in general.
Yeah. And and I think it's also of note that as far as we know, he's never actually worked in a veterinary clinic or in the veterinary industry or in the veterinary field. He has worked in telemedicine before. I think he said that in that interview.
Yeah, I believe he was a partner, or I don't know exactly, but a partner investor, one of the original guys with the human telemedicine, the HIMS and HERS, the two different companies that are human telemedicine.
Which essentially both of those telemedicine companies are essentially access to prescription medications. So I think it's, it was a tough interview to listen to somebody who actually never worked in our field talk so poorly about, our colleagues in this field.
Yeah. I agree.
So I think we'll just, start out with the hardest thing, right? The pain point of veterinary medicine is finances, right? Rising costs of everything. I mean, I don't like what a lot of things cost anymore, let alone veterinary medicine. I think a lot of people feel that pain point. And so I think we'll just dive right in with that.
Okay.
There was a statistic that since 2019, so right kind of at the right before COVID-19, right? It's where this last thing looked at, and it says that the veterinary medicine has increased 42%. The cost of veterinary medicine has increased 42% since 2019, which is higher on average than costs incurred in other places. So I think people really see that why is this rising cost of veterinary medicine not in line with the rising cost of other things, but it's exactly in line with the medical field. That's the same exact statistics on the human medical side, because we're the same suppliers, the same equipment, the same, like we're held hostage by the same.
Yeah, I don't think some people realize that 90% plus of what we use is similar or the same as what's used in human medicine. So there's a big connect there with the price, the things you see on the human side. We're experiencing the same things here on the veterinary side.
Yeah, and it's just unfortunately for us, we have that's something we can't control. I can't control what they're going to charge me for a bag of fluids, and if they triple the cost of a bag of fluids, which that's one of the things that really did significantly increase. I have no control.
Yeah.
Human hospitals to some extent have buying power of their conglomerations and their sheer number, and they're going to use, 1 million bags in a year, and we are not going to use a
we're just not going to have those volumes. So you're not going to get those kind of economies of scale to be able to tell a vendor that, well, this is what I'm going to pay. It doesn't work that way for us. And that kind of leads a little bit into what they were talking about, with the venture capitalists and the companies that are coming in and buying multiple practices, and you're seeing these large companies,
private equity,
exactly. Mars that owns VCA that owns a lot of hospitals, Banfield, et cetera. So and they're there, but that's not everything. But they've got a little bit of power there. I think they can do some of that. But your average veterinary clinic on the corner is basically getting the price they're getting. They're not haggling, getting a better number. That's not happening.
Yeah, there's an antifungal med that we need to use in equine eye ulcers, and so sometimes we have a stromal abscess, and I can inject that antifungal directly into the cornea. And so to get this, I could write a prescription to my client who could get it from a pharmacy at Costco for cheaper than the distributor would sell it to me. So I think sometimes people don't understand that we are held hostage by where we get our supplies and medications.
Yeah. It definitely affects, the what you can stomach, so to speak, to charge for your products and services. They're all related to the bottom line. And at the end of the day, it'd be great to say that, it doesn't matter. Money doesn't matter, but we've all got bills to pay and staff to pay and things to take care of. So you've got to charge for those things. And you know what, at the end of the day, you got to make some money. I mean, that's what's making the world go around. And, I don't know that there's a bank out there that's going to go, hey, well, you know what, I couldn't make the mortgage payment on the clinic this month, but don't you love animals? Just let it slide. That's not happening.
Yeah, I think that's oftentimes misunderstood, that high overhead costs of just owning a brick and mortar clinic and owning like an ER is like, those overheads are outrageous, right? Because you can't just staff it with Joe Blow off the street. You have to have people who can handle very emotional clients, high end medicine. You've got to have the equipment readily available to do things. You've got to have, and you're talking about, especially in an emergency clinic, you're talking about veterinarians that, want to work overnight.
Yeah. Yeah.
Because the most veterinarians no longer offer emergency services. Mm-hmm. They turf to these emergency clinics because it got to the point where you're working, you can't work 24/7. You physically can't, because you're not doing good medicine.
Yeah. You just burn out. You're not doing anybody any good, eventually with that model.
I mean, we hear this a lot, right? The veterinarians are in it for the money. And I think they hammered that over and over and over. And I think sometimes what people don't get is when you talk about the average annual salary for a veterinarian, it's around $125,000 a year. And just, blanket statement, that seems like, a lot of money, right? $125,000 is nothing to sneeze at. That's a lot of money. But when you consider what their veterinary education cost them, it remains extremely expensive. So that, the debt to income ratio for veterinarians is very high. The average cost of veterinary school is around $185,000 that a student graduates with debt. And there are many, many students who graduate with more than $200,000 because they didn't have a veterinary school in their state, right? Like they were an out-of-state or non-sponsored student. And so they have they have more than a mortgage.
Debt. Yeah, they've got significant debt. And, also that 4-year veterinary school education while they're doing that's a full-time gig.
Yeah. People also don't get it, right?
You're
physically in a classroom 40 hours a week.
Yeah. So, can you work a little bit here or there? Yeah, but you don't have a full-time job. You have a full-time job and you're not getting income. So it's preparing you for something great. Yes. But, you're also having to, in addition to those loan numbers to pay tuition, et cetera, you're having to live.
It's a huge sacrifice. And this, it's the same sacrifice that medical doctors make. Sure. It's the same education, just one is an animal model, and then multiple species, right? The other one is a single species, a human model. And so they're both medical schools. We're getting the same education, but they, the average physician is graduating with actually less debt or similar debt and double the earning power.
A higher income. Yeah.
And so it's just, let me just tell you, if we were in it for the money, the vast majority of people would have gone to medical school, not veterinary medical school.
Yeah. We're just not that bright.
Yeah. I mean, I just saw the average statistic, like nurse practitioners make more than veterinarians.
Yeah. I think they were like 120, 130 something.
Yeah.
Yeah.
Yeah. So, and then there is, I think the other thing, we talk about the pain point in finances, and they address this in the interview is, well, there's a shortage of veterinarians, quote unquote, this shortage of veterinarians. And the veterinary shortage is very real. And they said that the AVMA covers it up, but the AVMA openly discusses it at every meeting. Right. So it's not covered up. They fully admit that there is a veterinary shortage, but a huge part of it is due to turnover, right? And burnout, not necessarily that we're not making enough veterinarians, but that veterinarians are leaving the field in record numbers.
Yeah. Yeah. You're just not seeing that longevity, those careers that are, practicing for 25, 35, 45 years. Yeah, exactly. There are those things that are kind of burning people out early, and they're making a decision like, this is not what I want to do. This is not how I want to live. And exactly, they're leaving the profession. So that's a big part of the low numbers. And like you said, the AVMA has addressed this and is addressing that. There are multiple. That's one of the things that, in the interview with Tucker Carlson and Spectre, they talked about saying that the AVMA was suppressing veterinary numbers. So, if you've got low supply there, then the demand is higher, so you can charge more. And it's like, that's not true. Not at all.
That's right. It's just
and
so
they
ridiculous.
made a comment about, he knew multiple schools that had given up on expansion or opening. There are 10 to 12 veterinary schools set to come online in the next 24 to 48 months. And opening the veterinary school is not some, hey, we'll just rent a warehouse and open up. I mean, there's some things you got to do. So it takes time to get there. But, and of the existing veterinary schools right now, I'm not aware of any that have not increased class size. So that they're trying to produce the veterinarians to fill the void that's been addressed. So this whole kind of AVMA suppressing the number to try and increase demand so you can charge more. It doesn't make sense. Why would the AVMA, who the way that they fund themselves is by the dues that we pay, they'd do better having more veterinarians paying more dues. So if it's that model, they'd want as many veterinarians as possible. So
right.
Yeah, so that doesn't make sense.
So I think that, and I think that it's interesting that we talk about, these veterinarians are leaving this field, and I think people wonder, why would veterinarians leave this field? And one of the things is, pet owners are frustrated with the cost, and a lot of times those frustrations are taken out on the veterinarian that has absolutely no control over the cost, right? So we have veterinarians leaving a lot, and a lot of people say social media. They were blasted on social media that, you know, if they can't save your pet for $0, then these people tear people apart on social media and they dox them, and they feel like their families are threatened and unsafe. And we have this low income to debt ratio of veterinarians, and they eventually, find another field, and they just pay off their student loans and move out of it. And it's long hours, right? It's longer hours in equine than it is in small animal, but small animal has some long days. I mean, how much time have you and your wife sacrificed away from your kids?
Oh, quite a bit. Yeah.
And how many times were your kids up at the clinic with you?
Quite a bit. Yeah.
Yeah.
We spent some holidays at the clinic, not
right?
not by choice, but yeah, that, and then it's part of it. So,
right. And then I also think there's sometimes some unrealistic expectations of pet owners, and all of this is just driving veterinarians out. And we have a suicide rate that's 4 times the national average and highest of any professional degree program. Veterinarians, we're losing them more than just burnout, right?
Yeah. I mean, it's a, especially I think for the newer grads getting out there, it can be tough to navigate those. You're there because you love animals and you want to make a difference. And when somebody says, well, back to you're only in it for the money and you don't love animals, or you would treat my animal for free and you don't have control. He's like, I can't do that. And like you said, it's kind of that spiral. If you hear that every day, it affects you.
Yeah, it's just hard. It can be a rough job.
Yeah.
During that interview, they make the comment over and over again, like, that we basically emotionally blackmail people. Like, what wouldn't you do for your pet, right? And I think that's a big thing. Like, there is a humanization of pets to people, right? They call them family members or fur babies, which I find, from a horse person, right, I find that a little bit of disturbing. But for the small animal people, you guys hear that every day.
Yeah, it's normal. I mean, so you've certainly seen that, change over time, and even the time that I've practiced, you've seen that kind of grow, that human animal bond, and we celebrate that and encourage that. We're happy with that. But yeah, it sometimes it makes it difficult to make an objective decision versus a subjective decision through the lens of, well, that's my baby. And so, we walk that fine line of trying to provide care and do the things that they need, with realizing, kind of the parameters we work within.
Right. Like, sometimes there's a limited resources and you have to do what you can within that.
Right. Exactly.
But I also think that with that, right, they call them family members and they expect the same care that they would receive if they went to a human hospital. They want their pet to receive that same level of care.
Well, yeah, you want the best for sure. Yeah, it's a family member, and so, like you said, yeah, when you go in, you want the best. Well, it's one of those that, well, it's hard to drive a Mercedes on a Hyundai budget, so it doesn't work that way. So that's part of the thing you've got to realize as well. So saying again that you're only in it for the money, you're trying to do those things, I think is a little disingenuous.
Right. And I think we talk about, well, we're lucky here, right? Like, we are spoiled. We have we have a 3T MRI, like the best quality MRI that you can have. And we've got a CT and we've got nuclear scintigraphy, and we have all of these super, super high level diagnostics. But we kind of work that way because not every practice can have this, right? This isn't something that you can offer in every single hospital. It would literally make care unaffordable. So that's why we have this one central location that everybody can send their cases to. So our model is to try and make it affordable for the person that would otherwise it would be completely unaffordable. And it's still not cheap.
Oh yeah, but, no, not at all. Not at all. You're exactly right. So yeah, trying to pool those resources here under one roof and offer those to the referrings, like you said, and the pet owners out there, so we can get these things done at a reasonable price. Again, like you said, it's not cheap, but that 3T magnet sitting back there is not cheap as well, and it's one of those that it's whether it's running or not, it costs us money. That's one of the things too. People kind of don't understand is we've got to keep that room cool. A lot of things are going on back there that costs money whether it's running or not. So it's
I mean, like, do you like helium? Because there's $80,000 of helium inside that thing.
Yeah, exactly. So it's not one of those that you're like, hey, we're coming up on the weekend. We're not going to be scanning anything. So just, turn it off. But that it doesn't happen. It's cycling and running. So going a little bit of standby mode, but it's still taking power to run that thing, keep it cool, and do what needs to be done back there. Yeah.
Yeah. And people expect that level of care for their family members. And so, and veterinarians want to offer it, but it comes at a cost. It just is what it is. And and I think that, they talked about in that thing about what they, the rising cost of veterinary care, but they would do anything for their pets. And I think that when we talk about them as family members, one of the examples they gave was Mr. Carlson's dog, gets, I guess they repeatedly have not learned their lessons about porcupines.
The porcupine comment.
I kind of want to ask, are they Labradors? Right. Are they Goldens? Are they everybody's best friend? They're convinced that they're going to make that spiny friend.
Their friend. Yeah.
Right. And so that, he's had repeated porcupine incidents, and he talks about, now he doesn't even take him to the veterinarian. He just spends several hours removing those. And I think that there are plenty of people that can agree that if this is your family member or your child, you probably wouldn't hold your kid down for 4 hours and pulling porcupine quills out of them, right?
Yanking quills out.
Right. It's incredible. If you've never had the porcupine experience, it's not pleasant. So, that's one of those things where when we talk about these things, like that's what veterinarians do, right? We ease suffering. We make things, we get better living through chemistry, right? We've got drugs and we can do things. They kind of talked about anesthesia, and when they were talking at one point about, the dangers of anesthesia, and from a place that anesthetizes things literally every day. It's thoughtful and with purpose and with training, and we consider it very safe and just entirely less stressful for your animal, right? I mean, and I have a harder heart, right? I did horses. I have sometimes with those horses, they got to prove they want to live.
Right.
Like sometimes they've got to buck up and prove they want to live, because I can't pick them up and snuggle them and carry them some way. Like sometimes they got to get up even when they're hurting and get on a trailer, and so I can get them help. And so you have to kind of harden your heart. But even my cold, dead heart was a little sad about that. Those poor dogs having porcupine quills yanked out of them. I won't lie. And so the next topic that we get into for that interview was the big bad private equity. I guess, when I first started here, I said I would never work for a corporate organization. Mm-hmm. I would never work for private equity owned. And we are technically now private equity owned, but it hasn't changed. Our business doesn't change, right? Yeah. Our commitment and we are lucky, I guess, with the group that has bought us, that we're still allowed to practice independently. We're not told how to practice medicine or whatever the overlords say is going to happen. But I think that when we talk about things like that whole episode was private equity is the big evil, but I think it's right. Nothing's all good or all bad.
Exactly. Yeah. I mean, there are bad apples in every bunch. I mean, no matter, where you look, but I think there's a lot more good than bad across the board when you start to kind of break things down about what some of the money that's been injected into these practices has helped them do to further their diagnostics and treatment protocols and things that they can do. So again, are they all perfect? No. Are they all bad? No. And part of that, yeah, and part of back to that the interview with Tucker and Spector, we're talking about that the AVMA is in bed with private equity trying to buy up practices, and that's absolutely rubbish. That AVMA has nothing to do. They're not supporting it. They're not in bed with them. They're not telling them what practices to buy. That's not happening at any level.
No, I totally agree that private equity and the AVMA, the organization, are they're completely separate entities.
Yeah.
And I think at one point they talk about, the lobbying power, the millions that AVMA spends lobbying, which, I mean, I think you and I have talked about this before. Like, I would love it if the AVMA would spend millions on the things that, make a difference in, especially like public health and animal life. But the AVMA doesn't have millions to lobby with. Like,
right. Well,
unfortunately.
Unfortunately, but I mean, we would if, like Tucker and Joe said we were the AVMA, a cartel.
Right. Oh, that's
they
right.
called it as well. Yeah, it's a cartel running this situation. So, but yeah, there's a lot to be worked on, but some of the things they're claiming ain't happening.
Right. And I agree. Like we've talked about, the private equity is, I think there's a place for it in veterinary medicine. Do I have to love it? No, but I think there's a place for it. There are a lot of veterinarians these days who don't want to own. And so what are, you as a business owner, if there's no one in your practice that wants to own your practice and you can't grow it up, and at a certain point, you probably don't want to be doing what you did at 25 when you're 75. There's got to be an out. And I think, what do you do? Close the doors and all of your staff and you know what I mean? Like that's not good either. So
yeah, just tell everybody to go home. Yeah, that's not a great option. But you're exactly right. It's for some practices and their situations where they don't have somebody coming in to take it over, an associate that's been there for a while, or a family member. You got a kid that went to school and came in. So yeah, that's for some guys that's the way out. You can't practice forever. You're either going to retire or die. So something's got to happen. Yeah.
And I love being a veterinarian. I love it. There's nothing else I'd rather do, but I also don't want to, drop dead doing my job. I'd rather drop dead doing something with my family. Or, you know what I mean? Something I enjoyed.
Sure.
Like, I think that's...
I think there are a lot of people like that, 100%.
Right. And I think, so with, because we're all part of this cartel in with private equity, AVMA is a cartel, in with private equity, and the big claim that, all we're doing is killing pets, and we're killing pets by not allowing telemedicine. And I think that's a super important point, is that we as veterinarians oftentimes practice telemedicine within the bounds of our state laws because we have physically we have a relationship with these clients, we have a relationship with these pets, we have relationships with their families, we have talked to them, we know the care they receive, we know the food they're on, like we have so much knowledge of our individual patients. And so we are able to, like they basically talked about, your veterinarian won't answer questions over the phone or won't look at pictures. And how much of our day are we essentially doing telemedicine, helping other veterinarians with radiographs, helping other veterinarians with diagnostics?
A lot of the day.
Yeah. And I think the one thing that they don't understand is, like, there are some veterinarians who are starting to charge for it because it is a significant amount of time, but there are still many, many, many veterinarians that when you call or send a picture or an email or a whatever, you're not being charged for that. Those veterinarians are answering your questions and helping you because they're good people who, they're not in the business of killing pets, right? Like, it's just, like, it's crazy to me when they talk about, like, the AVMA, like their focus is killing pets. Well, then who would I work on? Like, where?
Right. Yeah.
If they're all dying, where do they come from?
That's a bad business model.
It's terrible, right?
Just kill all our patients.
I mean, they talked about, like, okay, if you use their telemedicine service, like, of course you're not getting, they kept saying their shots, which, vaccinations. I think preventative medicine is important. And I have worked, even as a horse person, I volunteered in certain areas doing vaccine clinics, especially trying to get the rabies vaccine to as many dogs as possible, because that is for me, that's a public health concern, right? The humans that are exposed to it, we're trying to minimize that, right? Because that's a fatal disease. So I think it's important. But I will say, at those vaccine clinics, like, we are literally just, churning animals through. It's a public health service. It's low cost. Generally, they're subsidized by a private donor. Like, there's money that came into them. So when they say, like, how can they afford to do them so cheaply? Usually there's some subsidized grant, something. So there's extra money coming in, which is one of the ways they can do it less expensively. And then secondly, like, you're not examining those animals. You're doing a brief visual exam to make sure they're healthy enough to be vaccinated, but I'm not touching, I'm not looking in ears, I'm not,
it's not
touching lymph nodes or whatever it is you small animal people do, right?
No, it's not a full physical exam, exactly, 100%.
And so I think that when they talk about telemedicine, I think that the full physical exam that a talented veterinarian does is worth every single penny. You're getting a deal. Every time Lon Hays puts his hands on something, whatever that physical exam charges, you're getting it for a deal.
Yeah. I mean, and certainly, I think telemedicine has a place. I mean, I'm not poo-pooing the whole thing, but I think that it is difficult for me to imagine how you would practice that way specifically, and like you talked about. But I think veterinary medicine is such a tactile profession, as far as, like, with when things look, they feel, they sound, they smell, gives you such insight into that patient, in addition to obviously how the heart sounds and the ears look, but just that whole package. And telemedicine, it would be tough to do. It's one thing for, I think, on the human side, for me and you to have a conversation. Me go, well, Amy, where are you hurt? No, it's my left side. It's here. When's the pain happen? Well, me asking you about your dog Pistol, well, Amy, where's the pain? I don't know. Well, can you? I mean, there's so many ins and outs. I don't know how. Now, once we've established a relationship, and I know Pistol, and Pistol likes to eat things off the counter, and Pistol probably has pancreatitis now, it can make it a little.
She is hungry, Lon.
Yeah,
She's hungry.
It's very, very difficult for Pistol, but it like you said, you got that relationship, so it makes it a little easier to kind of to put the X's and O's together to get to a picture. But for just having someone call you about doing telemedicine and you've never seen the pet, man, that's tough. Answering a general question, not so much. But yeah, I don't. It's hard for me. Maybe I'm the old guy to wrap my mind around how you really do that without having hands-on. Again, to diagnose a lot of things that we deal with.
Well, and I think the old funny stories of I don't want to see my doctor. I want to see my vet. Mm-hmm. I think that's because, so much of human med has gone away from the human doctors don't put their hands on you anymore. They don't look at for any other problems. Like they come in for whatever you tell them is wrong. And that's all that you're getting addressed versus when you go into a veterinarian. Yeah, I listen to the owner. They're telling me the problems they're having, but I might be seeing something that they're missing, right? Because their veterinary, their dog can't talk.
You kind of get numb to some of the things with our pets because you're around them every day. So it doesn't strike you as unusual or odd that that's happening versus somebody else seeing it for the first time and going, well, that's not right. So, you kind of get numb, I think, to some of these things, again, because you've seen it every day. So it doesn't, again, strike a chord with you that it could be an issue.
Yeah. And I think that it's funny to me because when we bring up like the pain or the dog limping or whatever, I'll hear people say, well, I mean, he doesn't really hurt. He's just limping a little bit. And I want, you want to respond with, well, do you limp for no reason? No, you limp when it hurts. Right. And so sometimes I think there's a disconnect with we're expecting human level care, but then we're not always thinking like human level. Like dogs don't fake things, right? They're not going to pretend to just get out of a walk.
Exactly. The old adage, if you limp your lunch. So they're really good at hiding things for a while. And then when they start to have issues, they're usually significant to some degree.
Yeah. We keep comparing veterinary care to human medicine because we hear from people all the time, right? That's what they expect. They want that level of care.
Yeah. Well, and you also hear, well, this is so much more expensive than my regular doctor or my dentist or take your pick.
Right. And I think that it's more expensive, right? Because you don't really see what your doctor's charging you, right? You see the copay on your insurance.
Right. Yeah. And you haven't done the math of what you paid monthly.
Correct.
For the insurance and the deductible. The
deductible and the copays and the, like I know what's coming out of my check,
I do too. Yeah.
Every month.
And it's not little.
No. Yeah. You know what? Maybe I should have discussed this before I decided on 2 kids, right?
Yeah.
Or I just pick the one I like and insure that one.
Yeah. You're on your own.
So, but then again, and we talk about human medicine all the time. Like there was a recent poll, a Gallup poll that said 23% of Americans think that healthcare in this country is in a crisis. And 47% say they have significant major concerns with healthcare in this country. So that's 70% of America who thinks that our healthcare system is broken. And so when they try and compare to human medicine and, well, it's so much more expensive. Well, first of all, insurance controls human medicine right now, right? It's not, if you want to talk about a cartel, like we could go down that, road, but I just don't give out my address because I don't want them coming after me. And so, and as far as humans go, for our medical care, we have less access to doctors. If you go to an urgent care, you're probably going to see a mid-level practitioner. You're not going to see an MD or a DO. We have less access to trained professional medical doctors than what clients have, accessible to veterinarians.
No,
So it's,
100%.
more efficient and it's more readily available.
Yeah, I agree 100%.
I don't know. I don't think, we're not going to solve all of the problems in the world with veterinary medicine today, but I think that, I want to reassure people that yes, veterinarians have to make money just like computer engineers and just like teachers and just like grocery store workers and literally anybody who has a job. Like everybody expects to get paid for their job, but it's
They're
not
compensated for their time. Yes.
right. But I think that whole interview was essentially an advertisement that disparaged the veterinary community. And I'm just not okay with it, especially for these people that are already struggling in our field.
Yeah, I agree 100%. I think it went too far. It was a little inflammatory. It was a lot of finger pointing at the veterinary profession in general about, again, back to we're only in it for the money. And then go from there, cartel and private equity and mafia and
the killing your pets,
your pets, and can't get taken care of, and the $5,000 dental, which is
we didn't even get into that. We got to back up.
So that's a little crazy to me, but it's easy, I guess, to just like us sit here and shoot the bull and say whatever you want to say. And they did. And again, it's back to like you talked about, like this is a paid advertisement. This guy is a sponsor. He's an advertiser. He's running the company. He's not running out of the goodness of his heart. Maybe that's how it started. I don't know, but I'm pretty sure he's getting compensated. He's making money. So it gets you a little revved up about the things that were said when it's not true. At the end of the day, most of what they said was substantially untrue. So
untrue, unsubstantiated, and inflammatory.
So, give me some facts instead of just spewing stuff. Just like him saying that he was aware of, Spectre was aware of several veterinary schools that weren't expanding because AVMA was shutting them down and didn't want them to do that. And I was like, no, they're 10 or 12 coming online again. You can, go research it. You don't believe me.
Right. The AI will tell us. Right.
Yeah, Google it, whatever. It's there. I'm not making that up. So that stuff drives me a little crazy to listen to somebody like that. Again, say the things they say. It gets people fired up. It gets people, think some bad things about a profession that I really love and care about, and in general has a lot of good people doing a lot of good things for the right reason. So that's to me, that's it kind of pisses you off at the end of the day.
And I think it's important to note that, do you remember what they talked about in your school, like back in the day when you went to veterinary school? Do you remember that what they talked about that was like the vast majority of every veterinarian's shortcomings? Like if there was something that veterinarians needed to work on, that what they would recommend that you worked on once you graduated? Because I know what it was for us. I'm curious if you remember what it was for you.
No, it's been so long.
So what they told to us is that veterinarians are poor businessmen, and if they were great businessmen, they wouldn't have gone to veterinary medical school because it doesn't pay off in the long run. So they hammered that to us, that you've entered a field that's you better love because you're not in it for the money.
Yeah. I'd been out maybe a couple of years and went to a seminar, and it was a business, it was a seminar, and I can't remember the guy's name. This is his line, so I'm not taking credit for it, but I can't remember who it was. So be frank about that. But he basically was, talking about, financial planning and retirement planning and everything. And, he had a
right,
presentation, and he's like, don't worry about retirement. And everybody's kind of like, what? He's like, 90% of you aren't going to retire. You're just going to die, and you're going to be in the same house you are right now. You're not doing any. And it's like, it's kind of like 30 years ago, kind of nail on the head a little bit. Yeah.
Right. I mean, that's, it's just, here's the thing. I love my field. I love my job. I love, everything that I do. And I'm excited. There are definitely veterinarians who are burning out and who are tired of being vilified on social media. And like, we see that, but I'm still excited about this field and love it. And there's so many good things in this field. And so, to hear somebody just present unsubstantiated, false things, lies, And then do not read the comments on that interview, because then, every person that's ever lost a dog that the veterinarian didn't work for free, basically called us the scum of the earth. And I mean, it's hard to read that about yourself, right? About your colleagues, about your profession.
100%.
And it used to be dentists had the highest suicide rate because, nobody wanted to go to the dentist. Right. Yeah. And now it's veterinarians.
Yeah. Yeah. It's definitely a strange dynamic. I mean, again, a lot more good than bad in the veterinary field. But when you have a national podcaster or whatever you call Tucker Carlson, media guy, have somebody like Spectre on and talk the way they did about the veterinary profession again with no facts, and it's back to their feelings. Well, feelings aren't facts. So you get people inflamed, worked up, like you said, read the comments. And if you scroll through the comments at the bottom of that podcast, you think that we are the devil. Veterinarians are the devil. We're Satan. We are here to kill animals and take money. And you're like, no. Are there bad veterinarians? Yes. Are there bad accountants? Yes. Are there bad medical doctors? Yes. You can find bad in every profession, but in general, you're not going to find better people across the board than in the veterinary profession that want to help you and your pet. And I hate that it costs money, but it does. And that's the fact. We've got bills to pay. You've got bills to pay. Like you said, nobody's working for free. So it's a fine line of walking those things to get things taken care of, take care of their pets, take care of their family. And you know what? Take care of you and your family, which is your family and your staff.
Yeah. And I will say, like, on that note, when they talk about, all of the evils of private equity, one of the benefits is that with being able to group ourselves with a couple of other practices, right? Our staff now has lower cost health insurance and they have more benefits than we've ever been able to offer. We've been able to offer, parental leave. And I think one of the other things people don't get is, if you want to talk about somebody who's underpaid, like, let's talk about that veterinary technician, right? 100%. Good Lord.
Yes.
We make half of what medical doctors make as veterinarians. Like, when you compare them, our licensed veterinary technicians to nurses, like, it's a shocking disparity in wage, right? And so, they're doing it because they love it. But now they're in a position where, like, I can afford to keep, we have, hands down, we have some of the best technicians in the entire country. Yes. And I can keep them now because I can offer them some benefits that they can't find other places, right? Like, sharing those resources to be able to have cheaper health insurance and offer them some benefits is huge for us.
Yeah. And that goes back to, and we're kind of circling back to the cost of doing business. But like you talked about before, people want the best. And, for us here, the way we can offer you the best is to have really good people, and good people cost money to hire. So, when I started back in the Stone Ages, I was a high school kid doing dentals,
right?
Because that's all, I did. And that doesn't happen anywhere. Nobody's going in like, yeah, you just let that kid who's making, $8 an hour clean the teeth. It'll be fine. No way it goes wrong. People be all over you. That doesn't happen anymore. People don't want that. They want that cost, but they don't want that service. I assure you. So
yeah, they want you to have gone to every dental CE, and they want dental radiographs. And honestly, I just saw a statistic that pets are living 230% longer. And part of that is access to dental care, which affects all health, right? Like, dental care is what we offer, like, our lowest income families, like, that's a priority.
Yeah.
That's health.
And that kind of goes to my dogs lived to be 17. They never had to clean their teeth. Well, okay. I'm not saying you didn't. And some dogs, just like some people, have really good genetic oral structure, and they can last that long and not have a problem. But what was the quality of life? Did the dog have any teeth left? Could it eat? So, did it have underlying kidney issues and heart issues and liver issues because of what was going on with the gum disease, et cetera? So, there are so many variables when you just say, well, let's be 17. Well, it might have been a crappy last 4 or 5 years.
Right. Was it quantity, but not quality?
Exactly. But you never hear that. Yeah.
Yeah. Well, we were kind of all over the place at the end. But this is it's emotional. What I tried to take some of the emotion out of it because I was fiery, right?
Well, it was a hard. I mean, as a veterinarian, it was a hard interview to watch and stomach. I mean, honestly, a little bit, and I think it's natural if you're passionate about the profession and you love the profession. If it didn't get you a little hot, you need to think about why it didn't. And not hot like I need to break my computer hot, but yeah, a little like, well, I mean, I don't agree with this. I don't, yeah. It's shake your head and go, no, that ain't right.
I think they presented this incredibly simplified view of an extremely complex issue. And I think that's what, we just encourage people who are hearing this, be kind to your veterinarian, say thank you. They're out there doing their best. They're missing, they're missing kid plays and sports games, and they're staying up late researching things, and they're calling specialists. And, there are so many things that they're doing for your pets that you don't see.
Yeah.
Because they care, not because they're some soulless, money hungry.
Money grubbers. Yep.
Right.
Yep. 100%.
So for people who haven't listened to the podcast before, at the end, we usually have a tail end tip from Lon. And it's usually some medical, something we can use. But do you have a tail end tip?
Well, I'll say, like, because we were talking a little bit about preventative medicine and the dentals and things, I'll say what I used to tell clients when we had a new puppy or kitten coming in and we were kind of getting started on their wellness journey. It's like, if you only take away two things from me after this visit that will make the biggest difference for your pet, is to keep their weight regulated and keep their teeth clean. Do those two things and your pet will live probably a pretty good life.
I think those are two X. That's a double tail, the double tail end tip. That's a wagging tail.
There you go.
And I guess mine would be set up a veterinary emergency fund for yourself that you don't touch. It doesn't matter how much you want that vacation. It doesn't matter, this kid's school trip or whatever, whatever other luxuries you give up. I would say sock away a little bit for a veterinary emergency fund.
Yeah, just in case you never
because
know.
I tell, I work, again, I'm in the equine field, right? And we do some pre-purchase exams on some incredibly expensive horses. Like sometimes I'm helping these clients buy a horse and I'm thinking like, it's my house.
That costs
they're buying my house right now.
Or more. Yeah.
Right. And then they come down off of buying this incredibly expensive horse. And then they're talking about, cutting corners somewhere else. And I'm like, no. The purchase price is the cheapest part of owning a horse. Like that. I don't care what you bought this horse for. The purchase price is usually the cheapest part of owning a horse. Like investing in this horse longevity. That's where the money comes in.
Yeah. That the old adage of, buying the Ferrari and never changing the oil. It looks good. You blew the motor up. It's never going to move again. So yeah, back to that's the cheap part. The preventative stuff, it makes a difference down the road. Yep.
I think that's 100%. Excellent. All right. So I think we'll kind of wrap up this episode, and I appreciate your time. And look, we did so well. We didn't swear. We were not a heated mess, right? We did pretty good.
Yeah. Yeah. We kept it pretty clean.
Well, thanks for joining us for Animal Imaging's Diagnostic Tails podcast, and we will see you next month.
All right. Thank you.